As the COVID-19 pandemic continues, we bring your attention again to impacts on people in detention. Almost 200,000 people are reported to have been infected in prisons, and over 2,100 people detained have died in 39 countries due to COVID-19. However, these numbers in reality will be much higher. A data gap and limited or no testing in places of detention has been compounded by a lack of transparency. Months on, we are seeing that prolonged restrictions in many prison systems have violated human rights and contributed to an increase in violence and a growing mental health crisis. Authorities need to urgently review what measures are in place against international human rights standards, including the Mandela Rules. There must be targeted, sustained efforts to mitigate the negative impacts of COVID-19 related measures. Any restrictions that are still deemed necessary based on health grounds should be proportionate, imposed for the shortest time possible, and be reviewed regularly. Today we call on the Council and Member States to not only stop and address the human rights violations suffered by people in detention during the COVID pandemic, but also to look longer term at systemic reform to address the global prison crisis, which has left the 11 million people in detention globally so vulnerable in the first place.